In 2014, a mother in Flint, Michigan noticed her son's hair falling out. His skin was breaking out in rashes. He was having trouble concentrating in school. She called the city. They told her the water was fine. She called again. Fine. She called a third time. Fine. It wasn't fine. The water her son had been drinking for months contained lead levels high enough to cause permanent brain damage. The government had the test results sitting on a desk. They knew. They just decided that telling her would be too expensive. Her son will never fully recover. And nobody went to prison. But Flint wasn't the only crime. And lead in the water wasn't the only weapon. What you're about to hear is worse. In 1996, a pharmaceutical company called Purdue Pharma released a painkiller called OxyContin. They told doctors it was safe. They told patients it wasn't addictive. They had sales representatives visit medical offices with gifts, meals, and speaking fees. They created a scoring system that pressured doctors to prescribe more. What they didn't tell anyone was sitting in their own internal documents. They knew OxyContin was highly addictive. They knew patients were becoming dependent within weeks. They knew doctors were being manipulated. Internal emails described strategies to target vulnerable patients in high-pain, low-income communities specifically because those patients had fewer options. Within 5 years, OxyContin was the most prescribed painkiller in America. Within 10 years, communities across the country were devastated. Families destroyed. Entire towns hollowed out. But here's what made it a crime and not just a mistake. When the first overdose deaths were reported, Purdue Pharma didn't pull the drug. They hired more sales representatives. By 2001, the FDA had evidence that OxyContin was being abused at alarming rates. Purdue Pharma knew too. Internal documents show executives discussed the growing addiction crisis in private meetings while publicly defending the drug's safety record. They hired scientists to produce studies that contradicted independent research. They funded patient advocacy groups to lobby against tighter regulations. They spent millions influencing the very system designed to stop them. The death toll climbed. 100,000, 200,000, 300,000. In 2007, Purdue Pharma pleaded guilty to federal charges of misleading the public. The fine was $600 million. Sounds significant. But that year alone, OxyContin generated $2.5 billion in revenue. They paid the fine and kept selling. The Sackler family, who owned Purdue Pharma, walked away with an estimated $11 billion in personal wealth. No family member went to prison. By 2023, the total overdose death count linked to opioids had passed 500,000. That's more than every American war since World War II combined. Now back to Flint, Michigan. Because the full story is worse than the hook suggested. In 2014, city officials decided to switch Flint's water supply from Lake Huron to the Flint River. The reason was simple. Money. The switch would save the city $5 million over 2 years. What they didn't do was treat the new water source for corrosion. The Flint River water was significantly more corrosive than Lake Huron water. Without treatment, it ate through aging pipes. Lead leached directly into the water supply. Into homes. Into schools. Into baby bottles. Within months, residents started reporting brown water. Rashes. Hair loss. Children developing learning disabilities. The city tested the water. The results showed dangerous lead levels. Officials knew by early 2015. They told residents the water was safe for another 18 months. 18 months of poisoned water. Served to 100,000 people. While officials sat on evidence that proved otherwise. But it gets worse. Someone was watching this happen from a distance and said nothing. The EPA. The Environmental Protection Agency. Their job is to protect the public from exactly this kind of danger. An EPA water specialist named Miguel del Toro discovered Flint's lead contamination in February 2015. He wrote a memo to his superiors warning that the city's water was dangerously toxic. The memo was marked for immediate action. His supervisors told him to stay quiet. They didn't want to alarm the public or create conflict with Michigan state officials. The memo was buried. Del Toro tried again. He went to researchers. He contacted journalists. He broke protocol because children were being poisoned. By the time officials finally admitted the problem in October 2015, thousands of children under 6 had been exposed to neurotoxic lead levels. Brain damage doesn't reverse. IQ loss is permanent. The policy change that followed created stricter lead testing requirements nationwide. But in Flint, 10 years later in 2024, residents still don't fully trust their tap water. And they shouldn't. Now let's talk about what's in your garage. Or your shed. Or under your kitchen sink. Roundup. The world's most popular weed killer. Made by Monsanto, later bought by Bayer. For 40 years, they told you it was safe. Spray it on your lawn. Spray it on your garden. Harmless to humans. In 2015, the World Health Organization classified glyphosate, Roundup's active ingredient, as probably carcinogenic to humans. Translation: it likely causes cancer. Monsanto immediately disputed the findings. They produced studies showing glyphosate was safe. Clean science. Independent researchers. Except it wasn't independent. In 2017, internal emails surfaced during litigation. They showed Monsanto employees ghostwrote research papers and paid scientists to attach their names. They showed executives strategizing how to discredit the WHO findings. One email literally said we need to orchestrate outcry with experts. They knew glyphosate posed cancer risks as early as 1983. Internal documents prove it. They buried the research, published contradictory studies, and sold it to you anyway. By 2018, over 100,000 cancer patients had filed lawsuits. October 29, 2018. Lion Air Flight 610 crashed into the Java Sea 12 minutes after takeoff. All 189 passengers died. March 10, 2019. Ethiopian Airlines Flight 302 crashed 6 minutes after takeoff. All 157 passengers died. Same plane. Same malfunction. Same preventable tragedy. The Boeing 737 MAX had a software system called MCOS designed to prevent stalling. But the system had a fatal flaw. If a single sensor failed, MCOS would force the nose down repeatedly. Pilots couldn't override it without knowing a specific procedure Boeing never told them about. Boeing's engineers knew about the flaw before the first plane was delivered. Internal messages from 2016 show employees calling the plane ridiculous and saying they wouldn't put their families on it. Boeing didn't ground the fleet. They didn't warn pilots. They didn't fix the software. Why? Because grounding the fleet would delay deliveries. Delays meant lost revenue. Revenue mattered more than the risk. After the second crash, every 737 MAX was finally grounded worldwide. But 346 people were already dead. Here's a different kind of crime. One you can't see. One that happens on a screen. In 2021, a Facebook employee named Frances Haugen leaked thousands of internal documents. They became known as the Facebook Papers. What they revealed was worse than anyone expected. Facebook's own research showed that Instagram was toxic to teenage girls. 32% of teen girls said Instagram made them feel worse about their bodies. 13% of British users traced suicidal thoughts directly to Instagram. 6% of American users did the same. Facebook knew this. They had the data. Internal presentations documented the harm in precise detail. But here's what makes it criminal. The algorithm wasn't accidentally causing harm. It was designed to maximize engagement. And the content that maximized engagement was the content that made vulnerable teenagers feel worse about themselves. Eating disorder content. Self-harm images. Comparison culture. The algorithm deliberately amplified it because users couldn't look away. Mark Zuckerberg was asked directly if he would stop. He said changing the algorithm would hurt growth. So let's connect the dots. Purdue Pharma knew opioids were addictive. They hired more salespeople. Flint officials knew the water was poisoned. They told residents it was safe. Monsanto knew glyphosate caused cancer. They ghostwrote studies saying otherwise. Boeing knew the 737 MAX was dangerous. They delivered it anyway. Facebook knew Instagram hurt teenagers. They optimized the algorithm to make it worse. 5 different crimes. 5 different industries. 1 identical pattern. They had the data. They had the evidence. They had the ability to stop. And in every single case, they chose profit over people. The policy changes that followed were supposed to prevent this from happening again. Stricter drug regulations. Water quality oversight. Pesticide testing. Aviation safety reforms. Social media age restrictions. But here's the uncomfortable truth. None of these policies existed before people died. The system doesn't prevent harm. It just responds to it after the body count gets high enough. Which means somewhere right now, another company has data they're hiding. Remember that mother in Flint checking her son's hair falling out? She wasn't paranoid. She was right. But it took 18 months for anyone to listen. So here's the question that should keep you up at night. What are you noticing right now that everyone's telling you is fine? What product are you using? What's in your water? What are your kids seeing on their screens? What medication did your doctor just prescribe? Somewhere in a corporate office, there's a spreadsheet. It calculates acceptable casualties. How many people can get sick before profit turns into liability? How many deaths are statistically tolerable before regulation kicks in? That spreadsheet exists right now. For something you're exposed to today. The only difference between the crimes in this video and the ones happening now is time. We just haven't found the documents yet. And when we do, someone will say the same thing they always say. We had no idea.